Dr. Henry Childers. I'm actually a cardiothoracic surgeon who now is practicing integrative medicine. My path basically went from, I was a chairman of the Department of Cardiothoracic Surgery, and because of my past profession of professional athletics, mainly America's Cup sailing, etc., my shoulders were destroyed. But I continued to work out because that's what you do regardless of pain. And finally it got to the point where taking high dose ibuprofen in the morning and at night just to sleep, I felt it necessary to get an MRI, which I did, and I was told that there was absolutely nothing I could do for my shoulder other than a replacement, which is devastating if you continue to try to swim a mile or work out and go to the gym and all of these things. A friend of mine who had been at Sloan Kettering Cancer Institute with me in the past was doing this crazy procedure, and he offered it to me, called ozone therapy. And what he did is, or what he was offering, was to inject a gas into my shoulder joint, which to me just sounded like a ridiculous concept. But because I had absolutely no alternatives, I flew down to Florida, and he did exactly that. And that changed the rest of my life and how I practice medicine. My research background's in cell biology and biochemistry, so I wanted to know how this thing was working, and I realized ozone, it's an oxygen species, highly unstable, highly energetic, and essentially what it's doing is turning on cell function and gene function and rehabilitating mitochondria. And by doing so, you're releasing, among other things, but what's specific to my shoulder, releasing growth factors and cytokines. That's the repair mechanism. I started doing more research, and Dr. Frank Schallenberger, who was one of my mentors and now a colleague, I reviewed some of his films of knees that were degenerated, people who were set up for knee replacement in the future, that he started injecting, and he did serial injections, and over the course of, I believe it was 6 months, the repeat x-ray showed what it looked like a normal knee, cartilage. And my first reaction was, wow, and everyone I showed this picture to, their reaction is wow. For some reason, that's the word of choice. And then I realized that's completely natural, and I should kind of expect it, because no one implanted my cartilage. I made my own in the womb, and as I grew up, and at 2 years old, I was making cartilage, and at 14, I was making cartilage, and probably 18 or so, I was still making cartilage until I was fully grown, and then in a very controlled way, which we don't understand, we stopped eliciting those growth factors and that gene expression. And I didn't make more cartilage because I wasn't continuing to grow. As we get older, we don't make cartilage typically because we don't turn on those genes because we're not growing. But I still have that gene. My DNA did not change. And if we have proper gene expression, should I be able to again realize cartilage deposition and bone growth and that repair mechanism that 14-year-olds have and 70-year-olds don't? Of course, if we can find that mechanism. We know that as we get older, we don't work the same way. Older people don't work like younger people. Younger people don't get cancer with very few exceptions, and when they do, it's often genetic. And if they break a leg, it's going to heal 100%. It may take 5 weeks because it's like fertilizer. It takes that much time for things to proceed, but it will heal 100%. Bone growth, periosteum deposition, neovascularization, just the whole healing process, the inflammatory thing that goes on until you're healed. Not 110%, it doesn't overheal, not 70, but 100%, then it shuts off because it self-regulates. When you're 70, that doesn't work. Again, you have mitochondrial dysfunction, and the biggest reason is you're not utilizing oxygen. This gets back to the ozone thing. But if you don't have proper gene expression, and you're more anaerobic and less aerobic, there shouldn't be an expectation that you're going to heal normally. Because if you're 70 and you break a leg, how long is that going to take to heal? You're not working right. Your stuff doesn't work. You have the same genes. We know if we turn it on, we're going to be able to do it, but we don't turn it on. The NIH describes the aging process as mitochondrial decay. So all of these areas which are of high interest to me, I immersed in. And this, the ozone practitioner, changed my practice. I don't do cardiothoracic surgery anymore. This is what I do. I was my first patient, and this is what I do.